Good evening, my name is V. Wynn, and I will be presenting on physical therapy as a career path. Physical therapists are certified health professionals that use prescribed exercise, hands-on methods, and patient education to assist patients that are currently facing both physical and internal challenges. Physical therapists oftentimes receive patients who may have come from a recent medical procedure, patients who have been undergoing certain diseases or conditions that involved a specific body part that may need physical therapy to relieve the pain, or also patients that may have accrued an injury over time. Physical therapists treat their patients through evaluating each case, through developing home treatment programs, as well as exercise programs for the medical setting, and also manual therapy and modalities to help their patient regain mobility, reduce pain, as well as restore functioning. Now, physical therapists have a major task, which is communication. Communication between physicians, surgeons, or nurses, essentially any medical professional involved in the case, is very important in order for all of those individuals to understand where the patient is at, what the goal is for the patient, as well as what must be completed in order for the patient to achieve that goal. Now, physical therapists oftentimes receive feedback from physicians and surgeons regarding what kind of weight-bearing limits the patient may or may not be able to exceed and what time period that is relevant for. And communication is also important amongst insurance companies to understand how many visits are accepted for the patient, as well as what treatment plans are acceptable for their insurance plan. And physical therapists must keep up to date with progress notes, evaluation notes, and discharge notes in order to do this with insurance companies. Communication amongst the patient and their family members, if the family member is allowed by the patient to be involved in the case, is also very important in that it helps them understand what they must do outside of the medical setting in order to improve their case and help them recover. And generally, physical therapists work in a variety of settings such as hospitals, travel physical therapy, home physical therapy, private practices, and even strength and conditioning facilities or gyms. Now, under all of these settings, physical therapists are still required to work under a manager or supervisor of some sort. In a private practice, for example, they may be working under an owner, in a hospital under a manager or supervisor, and then maybe home and health physical therapy as well as travel physical therapy. They generally work under an agency that receives instructions from facilities that they may be partnering with. Requirements in order to obtain a doctorate of physical therapy degree would be a 4 years bachelor degree at any college or university. Now, no specific major is required. However, it is suggested that the major is relevant to health or to physical therapy, just so that the prerequisites that are required of physical therapy schools may interlap with the requirements of classes to complete for that bachelor's degree. And every school accepts different prerequisites and also different observation hours. Observation hours such as inpatient hours, outpatient hours, paid hours, as well as unpaid hours. And a doctorate of physical therapy program is a 3-year program that consists of 3 sets of clinical rotations. Continuing education is available to physical therapists through the American Physical Therapy Association. They keep up to date with events such as seminars and conferences, as well as continuing education trainings for physical therapists to be able to use different techniques and different programs to help treat their patients. And residency programs are also available to physical therapists for continuing education, such as neurophysical therapy, such as pelvic physical therapy, such as tissue, scar tissue, specialties, all of those sorts of things. My 5-year timeline personally is to obtain a bachelor's, gather requirements, apply, get interviews, accept schools, obtain my doctorate, apply for residency, and apply for positions. And job resources are on LinkedIn and the APTA website. And my 5-year timeline includes completing my bachelor's, acquiring all of the resources I need in order to apply to school, and graduate with my bachelor's in May to July of 2019, begin interviews in November to February, and PT school acceptance period begins in June or February, and then also summer programs begin around June as well. And then I would like to graduate PT school by June of 2023, apply for residency programs such as neurophysical therapy, and then graduate from that program, apply for schools, and apply